Welcome to Health Strategy TV. Today I'm joined by Dr. Farath Arshad, who is the Deputy Chair of NHS Warrington and Cluster Board Representative. Welcome, Farath.
Thank you.
Could you tell me what are clusters about?
Well, cluster boards are temporary organisations that have been created for the sole purpose of encouraging and fostering the formation of clinical commissioning groups and helping them to grow their responsibilities, and also to help the remaining workforce within the PCTs to work with the emerging clinical cluster groups. This time next year, the responsibilities of the cluster boards will be substantially reduced, and in some cases that won't exist at all. So we're looking to wind down towards this time next year.
How are the clusters operating at the moment, and what are the benefits of having clusters?
Well, the benefits are primarily around ensuring there's sufficient capability and capacity within the remaining PCTs to enable them to discharge their statutory responsibilities around the remaining commissioning functions they have, and also for the staff that they employ, and also to make sure that we leave a healthy financial legacy for the organisations that we individually represent.
Would it not have been easier to leave everything as it was, given that PCTs are disappearing in 2013? Why have a change in structure just a year or so before they eventually wind up?
Well, it was very difficult to undertake the functions that the PCTs were mandated for, given the changes that were introduced by the government. A lot of the staff decided to move on or take early redundancy or retirement. So there was issue around capability and capacity right from the top level to grassroots. And so it was a way of ensuring that there was sufficient expertise still around within the PCTs as a collaboration as opposed to individual organisation, and that's the purpose for creating those clusters.
So an attempt to retain at least some semblance of organisational memory around commissioning?
Absolutely, so that we leave a healthy legacy.
The way the clinical commissioning groups are shaping up, are they going to be ready in 2013 to take on the commissioning responsibilities?
I'm quite confident that in our locality, majority of the clinical commissioning groups are ready, and one or two perhaps need a little bit more work, but they should be there, absolutely. And in fact, we're working towards authorisation very soon.
It was only some months ago, before the health bill passed into law, that many GPs were seen to be still at odds with the then proposed legislation. Are they really up for the commissioning role?
Well, I think part of it is the inevitability in the system, isn't it? The PCTs won't be around to provide that corporate business backup, and this is something that the local clinical commissioning groups will undertake, and part of their role is to encourage and to foster greater engagement with some of the GPs perhaps might be reticent, and they use their protected learning time to ensure that the support is there for those GPs that perhaps need a little bit more encouragement, coercion perhaps in some cases. So they are taking these responsibilities seriously. And I suppose, given the inevitability, we have to embrace the change and let's see what happens.
Mm-hmm. And what are the key challenges now that you face over the next, 11 months?
The first and foremost one has to be the financial element, certainly around the cost improvement plans for the totality of the cluster board area, to ensure that we leave a healthy legacy for the clinical commissions to take over from us, but also to make sure that all GPs within the clinical commissioning groups take ownership of the new agenda and work with the local stakeholders and the local authority, with the voluntary sector, with business support organisations that have been explicitly set up to support them to make sure that they get clinical commissioning right. I just wish somebody from the Department of Health came and lived within the working environment of my PCT and had seen some of the challenges that we try to address and seen the level of patient satisfaction that we had within our region, even though we were underfunded, and they would have seen what we achieved.